Anyway, guys, welcome. So, me and my life as a dentist. All right, so I'll start with a brief resume of mine. And all these letters that you see, they're things that we gather as we grow in our profession. I did my high school in Pakistan in 1982, and from there I've been working towards my bachelor's in dental surgery, my doctorate in dental surgery, and then some few fellowships and a master's. So it's been a long stride, yes. This is a profession that requires us to be constantly on our toes. Anyways, let's carry on. What is this career, dentist? What does it entail? We are the doctors of the stomatognathing system. It's a mouthful. It's just like the respiratory system or the circulatory system or what you guys learned. Stomatognathing system, it includes the mouth and everything in it. Like, the word used is mastication, that means chewing, which includes teeth. Then we have deglutition, which is swallowing, which includes the tongue and the throat. Then we have phonation, which is speech, and that requires the lip, the tongue, and the throat. And then there's respiration, which is breathing. And then we have some behavioral characteristic activities like clenching, grinding, and something that I made for myself, which is called a snore guard, because I snore. So those are the things that we kind of make. Dentistry is a very good industry. I don't know if you guys had ever thought of it, because this US News does the World Report on best job rankings, and when they do that, this is where dentistry is, or dental related jobs are in 2018. Number 2 is a dentist. Number 5 is an orthodontist. Oral surgeon stands at 8. Prosthodontist is at 16, and a hygienist is at 17. When you want to become a dentist, you have a high school with and then a 4-year college. Mostly science college courses and some other well-rounded courses are required. Definitely there are certain prerequisites. One of the things is a DAT, just like an SAT. There is a DAT, which is a dental admissions test, and they test you for whether you're capable of doing dentistry or not. 4 years of dental school after that. There's only one university in the United States, University of the Pacific in California, that actually has a 3 years DES degree. Then there's postgraduate qualifications that range in different fields of dentistry from 2 to 6 years. The 6-year program actually makes you an MD doctor, which makes you like a medical doctor, so you are dual qualified, and that opens for unlimited areas in the health sciences because you are a complete doctor. Hygiene degree starts with your high school diploma, but you need what is called 2 years of college courses, and those are the prerequisite that you need to complete, and then 2 years of hygiene school. These 2 years and 2 years get combined, and you get a 4-year bachelor's degree in hygiene. And some schools, you don't have to do it in separate places. They actually kind of sum it up in one place, and you do a whole hygiene degree program. In order to get into hygiene school, it is good to be kind of in the industry as a dental assistant or something like that, because it increases your chances of getting into hygiene school. Dental assisting is another area where you start going for 8 months to a year to a dental assisting school, and then you get an externship in a dental practice, and you get your license to start being an assistant. One of the things that is very interesting is that it is the salaries of the dental professionals. It's a pretty good paying job, and dentists starting salaries range from $90,000 to $120,000 a year, depending on where they start. And they're mostly paid on a percentage of what they do. So like if they do a certain procedure, then they get a certain money, and then generally the salary is calculated as a percentage. Hygienists start from $35 per hour to $55 per hour. depending upon, again, their experience and where they are located. That actually is a very well-paying field also. Assistants, they start from about $15 per hour, and they go to about $25 to $30 per hour, depending upon their experience and location. Then we have administrative staff, and they are also at very much par with all these different jobs, and average, they range from $18 to $35 per hour. How is a dental office set up? I mean, you guys have probably gone into a dental office and you've seen the dental office. The dental office has a front office, which is the first thing that you get in there. And this front office includes a receptionist or an appointments coordinator. You have a treatment coordinator. So the appointment coordinator is the one who actually gets your phone call, sets up your appointments, makes sure you're the one who comes in, you give them all the information. The treatment coordinator or the checkout coordinator, what they do is they actually see you out and make sure what kind of treatment you need next time, and then they schedule you accordingly. There's an insurance coordinator that actually talks about insurances, so that's another job, all right, that deals with calling the insurance companies and finding their, what your benefits are and stuff. Office and business administrators, like mine over here, they overlook everything. In the back of-
Oversee. We don't overlook it, we oversee it.
Oversee. Thank you. English is not my first language. So, back office. Back office is where I come in. I work in the back office. That's where my job is. That's where I take the patients and work with them. I also have help. And one of my biggest help is the hygienist, because the hygienist actually does a lot of work, which I'm going to just tell in a little bit. And I have a lead dental assistant that actually makes sure that the rooms are set, the rooms are all working fine, everything that I need in the room is there. And it's also a very good, big, responsible job. Then I have some expanded duty dental assistants, which are more than just dental assistants, because they can be one of the things that, all the things that they do around there. That is a sterilization technician, an x-ray technician that takes the x-rays, a lab technician that actually is the one who kind of fixes some of the retainers that break or anything like that, of the braces that you guys come across.
Can I get discount?
Some people, what?
Can I get a discount on those? On
Absolutely,
those?
absolutely, yeah, sure.
Awesome.
So
What
then,
do you guys-
so then we have all these overlapping things where one person can definitely take a lot of jobs on their head. Anyways, so what are the duties of a dentist? Dentist actually diagnoses and treats dental diseases. All right, and we know some of the diseases like cavities, cleanings. One of the most important thing about our job is this part, management. We don't treat, we manage diseases, and that's one of the biggest advantages of being in a profession where something like gum disease and all, these are ongoing diseases that need management, and that's where you keep on going for your cleanings every 6 months and things like that. Over and above what we do as doctors, we also do some business management, where we have a staff that we manage, we have finances that we have to manage, and overall the business, because we have to market and brand our office. Hygienist, on the other hand, prepares the records of the patients that they come in, and they get their medical and dental records, get their x-rays, and then after that, they get their teeth cleaned up. And one of the biggest and the most important job of hygienist is to work on the education of the patients on oral hygiene and monitor patients' compliance. That's very important, because what is monitoring patients' compliance? Can anybody take a guess? Have you gone to a hygienist?
Yes.
What do they annoy you most of?
You have me talking.
Talking, okay.
Trying to ask me questions with my mouth open.
Oh, absolutely, and?
Brushing teeth.
Brushing, but no, they annoy you most about the other thing. What is the next step? Flossing. Yes.
Told you
How
he was
many-
gonna check today.
How many people floss? Regularly.
Gary, you know.
Ooh, good. So we have a good percentage. So that is monitor patient's compliance. That's very important because there are certain times even I do treatment that I need those things monitored. And it's my hygienist that really makes sure that whatever I have done is working really well. Otherwise, they come back and tell me, hey, this thing is not working out very well or something like that. Hygienists also help me by, they numb the patient up for me. So that is something very important because that takes a good part of the job. And in fact, to a certain extent, they help me out with one thing because if I have the decay out of the tooth and clean it up, they can go and fill it up and they do some really beautiful fillings. Hygienists, in fact, my hygienists, I'm going to talk about that. They also help in the administrative work, and that is very important because they complement me because I cannot do everything myself. So my hygienists put the cap on and they actually do some of that. Now, why do I like my job? That's one of the biggest things that I would want to kind of let you guys know so that you can decide. All right, I like my job because as a dentist, I have 3 caps in one. I'm a doctor, I'm an engineer, and I'm an artist. So as a doctor, what do? I diagnose and treat dental diseases. I'd like you guys to see this picture because this is one of the things that
That's nasty.
that is nasty, and that actually is an oral cancer starting. And what this person used to do was there's this little tobacco thing that comes in a little box. They open it, they make a little ball like that and stick it there. And that staying there causes this. This is a pre-cancer that I saw in one of my patients. And actually he stopped putting the tobacco in and this thing reversed in about 2 months. But some people who don't stop, what happens? They get cancer. And oral cancer is the biggest killer of people of all cancers in the world right now.
Bro.
Cavities, which is what we know of. All right, that's something we treat as a doctor. All right.
Have you seen that before?
What?
Have you seen that before?
Oh, yeah.
Yes. What?
Even this week.
Alright, smart one.
Malformations of like impacted wisdom teeth, because impacted wisdom teeth is something which you guys will be coming across your friends and everything getting wisdom teeth pulled.
Show what?
So that is something, this is what a wisdom tooth looks like, which is impacted.
It's not coming straight up, it's going sideways.
So we go in surgically. Crooked teeth, and then crooked teeth become very nasty because it's very hard to clean. So what my hygienist does is they clean them up, they keep them clean, and then I put braces on and then straighten those guys out. One of the upcoming fields these days is implants. Those are 4 implants sticking out of the jaw, and then we can build on those implants. As an engineer, what I do is I design and build diseased teeth. What do? So when there's decay is a disease. So what we do is, depending upon the decay, we use gold, silver, resin, porcelain, and we actually design fillings to be able to excuse me, withstand the load of mastication, which is chewing. They need to be so flush that bacteria cannot go in between. You can brush them easily, floss easily. So they should become more like a normal tooth. That's what we strive to get. So I have to design that because cavities don't just happen in one spot. They can happen anywhere. So depending upon where it happens, we have to. As engineers, we also build bridges, dental bridges. So just a pun here to kind of help me, but we do make bridges. As an artist, I transform smiles, and this is something I enjoy the most. I transform that smile to that.
Congratulations.
Putting, man, thank you. Missing teeth, it just transforms into a very nice looking face. This is becoming more and more upcoming these days, the artist factor of smile, because cosmetic dentistry is really, really coming up. So my job gives me satisfaction because I make people happy. These are my happy patients. And you know what? They're really, you can see from their faces, they're happy. And I like that because that makes me coming to my work feeling good. So, a whole lot of smiling people. A dentistry is a very nice paying profession. It really pays. What does it pay? Yes, it does pay my bills. It pays the salary of my employees. Now I have 45, 50 employees. So that means my skills is actually running those 40, 45 families, those households. And that also gives me a lot of pride, because you know what? My skills has that kind of repercussions. It pays for my son's college, because you know what? I can pay for it. It pays for my wife's and daughter's shopping. Right? It's important, right? Yeah. It pays for my hobbies. Now this is my hobby. I
You own an
love
airplane?
airplanes. So I fly real airplanes, and I fly radio controlled airplanes that I build myself. So that is something. So what are the advantages that I see of this profession as me? I am my own boss. I don't have to answer to anybody. It pays well, as we saw. Very well respected in the community. When I walk around, you know what? People definitely give me all the respect. I can make a difference, and I do some charity work. I give back. And this is Medical Teams International is something I give back through, because they have a mobile bus that goes into poor areas, and I actually participate with them and do free dentistry. And that bus actually is a 2-chair dental office, full dental office, and I do everything in there. I can control my time, and this is one of the most interesting things, because I only work 3.5 days a week. That's all. So it gives me that advantage where I work Monday, Tuesday, and Thursday, and I make that kind of money. It gives me a very nice work-life balance, because you know what? It's not like you come across people, and I do come across people who are, you know what? They work 16 hours, 18 hours, 6 days a week, 7 days a week. And that's there. So there's a nice work-life balance. But this is how these career things do. They give you a direction where you want to go, because you are the ones who can take your life that way. It comes with disadvantages also. One of the disadvantages is it takes a lot of schooling to get there, because you know what? Yes, we did see that there are many years you put in to get there. You have a very big baggage, because you end up with a lot of student debt. But that shouldn't intimidate you, because you make good money, so you can pay it off. You are dependent upon a team, because dentistry is something you cannot do alone. So you have to be a people person, because you know what? You have to keep those people, because if you are nasty, your team is going to just leave you. People will leave you. So I am very lucky that I have a very, very great support staff. The other disadvantage that I have, and which is one of the most annoying thing for me, is people are scared of me for no reason. So how many of you are scared of a dentist?
Me.
See? And that really is one of the things, because I consider myself one of the coolest guys out there. Anyways, we at Rainier Dental have a motto, and we make smiles for a lifetime, and that is one thing very important, because we do make smiles for a lifetime, and you can see that on all those faces that I just showed. Thank you. Have any questions?